knock, knock. Hi, Mr. Smith. I'm Cameron, the nurse today. So I checked your documents and you're ordered to have a dressing change here right now. So we're gonna do that. I'm just gonna put your rail down so you're nice and comfortable. If you're okay, I'm gonna lift the bed to my working height. Okay. Can you tell me your name and date of birth? Okay, that checks out. Okay, I did come in earlier, asked his pain level, and gave him morphine to help because he was at a 7 out of 10. His pain is now 3 out of 10, so he is good. Okay. Okay. So, and the waste receptacle is already in the area. I would like it. So it is there. If it wasn't, I would move it. Okay. Just gonna get in here real quick. Try to keep you as covered as possible. Okay. Now I don't have a bath blanket, but if I did, I would place that just because it is on the abdomen, so it's pretty, close to the perineal area. Okay. You comfortable? Okay. I'm now gonna remove this, but I want to be careful so they don't get medical adhesive skin injury. So I'll just, if it's super sticky, I can use saline or adhesive remover to help remove the bandage. Just be careful, hold down the skin if it's real sticky in areas to minimize irritation. Okay, so I would note odor, color, all that. This is serif sanguinis, which is good for what we want. So I would then fold this because my red biohazard bag is in my sterile kit. So once I am done, I can place this bag into the biohazard bag and take it to my biohazard area. So it's looking pretty good. I don't see any drains, staples, stitches. Gloves off, hand hygiene again. Put new gloves on. So I am going to measure the wound. With a sterile measuring instrument. If there was tunneling, I would like to use one of the applicators, but for this I'm just going to use the regular wound measuring kit. So this is sterile, so I do want to be careful when I open it, not to don't want to touch any of the measurement area because it is sterile. So I'm going to measure. It's about 14 in length and 3 in width. Sorry, going to get in there, Mr. Smith. About 2.5 in depth. No, so the applicator checks for tunneling, which is underneath the skin that we can't see, which is not good. Okay, so now I'm gonna, I don't touch, so I would put the check pad on beforehand. I forgot to say I'd put the check pad under just so if anything spills, especially if I have to irrigate a wound, so the check pad would be under there. I'm going to move my table in the area I need it to be. I'm going to start my sterile field. I'll just hand hygiene again because I did touch the table. Okay. I'm going to peel it away from me just so I don't harm the sterile field. It's a little tough on me. And I want to keep my hands above my waist with the sterile field. So I can do my sterile gloves. There is an inch around the gloves, which is considered unsterile. I'm going to grab the tabs here. My glove is sort of coming, so I don't want to touch that. Okay, I'm going to start with my non-dominant hand, and I'm going to go from the inside since that is the unsterile part. Just want to make sure I keep my hand on the With the dominant hand, I'm going to go under the cuff, but it hasn't been touched, so I can do that just to get what I need. And I don't want it to roll. Mine tend to roll on my hands, so I've got to be careful of that. Okay, and just comfortable. Okay, and I'm gonna take my sterile field. Oh crap. I would get a new one because that did drop. I didn't grab it right. And it did touch the unsterile. So I'll put that side down because it did touch. But in a real situation, I would probably get a whole new sterile. If there's a dressing separate for this, I would do that. I'm gonna get there's another measuring thing, my biohazard bag. Okay, I'm gonna place this on the bed so I can throw all the bloodiness and the contaminated things in here. Don't want to turn your back to my sterile field though. And drop that. Okay, my ABD dressing. I won't be needing this for that. I'll leave that for now. And I'm going to open my sterile solution. And we're not irrigating this wound. That down. I'm going to leave a few of these out for patting dry. The rest will just go directly in here and covered in the sterile solution. Okay, just gonna kind of wring these a little. Splitting these up so it's easier when I do get to patient. Okay, so I'm gonna go from top to bottom, dirtiest to cleanest. So I'm gonna, sorry if that hurts. Try to be as gentle as I can to clean this. I'm only gonna use one for each wipe. Go on the outside too. Okay. And I'm going to use what I had left over to pat it dry, so when I put the dressing on, it'll be nice and dry so it can stick. We are doing this dressing change to make sure the wound is healing okay and that there's nothing going wrong, and to keep it clean to lower risk of infection. I'm now gonna remove this pair of sterile gloves. Okay. Hand hygiene. And I am going to need another pair. Make sure I don't turn my back to my sterile field. Get rid gloves. Open these. You do want to have an area so you don't make it unsterile. Non-dominant first. Stay in that cuff area. I would prefer to have it at a table that is above my waist. So I put my hand in kind of backwards. Okay, now I'm going to take my ABB dressing and apply it. If there was any orders for anything else, I would have done that. I'm going to tape it down. How's your pain right now? Is it any worse? And if it is, I would see what I could prescribe them and give them at the moment. Just do the outside. I want to make sure that this is at least an inch outside the whole perimeter of the wound. I don't remember if I mentioned when I was checking the wound originally after removing the dressing that I would check for drained stitches and staples and what their condition was. So if I didn't, there you go. Kind of stabilize this as much as it may need. And we'll just do one on this top part too. Okay, and then I would take my date, time, initials that I did this dressing change and apply it so the next nurse knows when it was last done. Then take this biohazard bag, set that here on the floor for now since I've already putting my regular trash inside the biohazard. Okay, just gonna put this down for you. Sorry we had to do that. It can be uncomfortable. Okay. And then I'm gonna just collect all my other stuff. I may need this for my unit or whatnot. Garbage real quick, and then I would put it in my biohazard bag, close that, take it to my biohazard area. Okay, is there anything else you need at this time? No? Okay. Lower them to the lowest height. Make sure their rails are up because that's what they needed. Make sure it's locked in place. Call light, water, or anything else you need. Okay, come back and check on you in like 30 minutes. Okay. Go out. I document all that fun stuff. Is there anything I missed? I don't think so. Probably might have, but thanks.